So somebody sent this piece in for by pointing out that it's not, that it's kind of like one of those pieces that we're not going to be fans of. So far, I've just seen the headline, and I have a feeling I'm not going to enjoy it very much. So that's fun. We like dissecting stuff like this. So here's the headline from Slate. Every Democrat should talk about healthcare like Amy Klobuchar does. Klobuchar. Okay. Why should we do that? Every candidate should talk about all the things they don't want us to have. Talk about healthcare like Amy Klobuchar does. All right. Minnesota Senator Amy Klobuchar ramped up her new presidential campaign Monday with the CNN town hall appearance, during which she was, of course, asked about Medicare for All. Her answer was pretty much what one would expect, given that she's branding herself as a practical moderate. In other words, she's not for Medicare for All. Okay, lefty Twitter was predictably displeased. There was a lot of thank you next. Okay. But even if you didn't particularly like the substance of Klobuchar's response, I didn't, I think she deserves credit for being forthright. Democrats would be better off if more candidates talked about healthcare with her level of candor. How so? Okay. After a bit of throat clearing about how many Americans still can't afford health coverage or health care, Klobuchar explained that her immediate goal was to build on Obamacare by creating a public insurance option. She even had a specific bill in mind, Senator Brian Chance's Medicaid buy-in, which she has co-sponsored. Okay, so here's what she said. What we need is to expand coverage so people can have a choice for a public option. And that's a start. You can do it with Medicare. You can do it many ways, but you can also do it with Medicaid, something I don't think we're talking about enough as a potential solution. This is a bill that that's enough. Schatz's bill is interesting, slightly sideways approach to healthcare reform that has advantages and disadvantages compared with versions that focus on Medicare. I wrote a longer piece about the legislation back in 2017. This is the author speaking here. There's also a big obvious drawback to the plan. Just as they've resisted Obama's Medicaid expansion, a lot of red states might reject Schatz care. So that's the buy-in option, the public buy-in option, which, by the way, Obamacare, quote-unquote, should have had in the first place. If you really want to build... Here we go. This should be the headline. If you really want to build a public option, it may be simpler and more effective to create a federal program. So... do you realize what that sentence was, right? That sentence should be the headline. If you really want a public option, we should just have a federal program, i.e. Medicare for all. So this person actually just admitted in one sentence that the rest of their article is essentially bullshit. And whenever you see all this, oh, it's just so complicated. It's just what we can do is we can have a public buy-in option that some states might take and some states might not. And then if you carry the two and divide the earliest decibel and then go to the house and ask everybody who their firstborn is and you give them health care and then you give half a health care plan to the middle child, then the youngest child still doesn't have health care, but they're younger, so it's fine. If we do all that, that might be a better path. No. A better path is Medicare for all. It's so complicated, really. Every other industrialized country figured it out. Every other industrialized country figured it out. No, it's not. No, it's not. You know what is complicated? What's complicated, and the reason it's complicated is because it's impossible, is to allow predatory insurance companies at the table and have a system that covers everybody. That's the complicated part. You know why? Because it ain't going to happen. And whenever you see articles like this, they're doing the mental gymnastics to try to keep the insurance companies at the table. Because that's what they want. They want the insurance companies at the table. We can't have them at the table. They got to go away. That's the only reason it's, quote, complicated. It's complicated according to the people who want to keep our status quo. That's who it's complicated for. All right, let's see if there's any more to this dumb article. Even if I don't love Klobuchar's policy instincts on this issue, I do appreciate that she bothered to explain what specific direction she would push healthcare reform in as president. Okay. Almost every candidate has been asked whether they support Medicare for all, but almost none of them, with exception to unofficial contender Senator Sherrod Brown, have explained in detail what their fallback plan is if it becomes clear that a Sanders-style single-payer bill or something almost as ambitious, trying to, for the richest country in the world to have the health care most countries take for granted. That's really ambitious. Can't pass Congress, which between the filibuster, okay, there's so much going. I'm not saying it could never pass, but I'm saying it might not pass. That's unfortunate because there are big differences. Okay, wow. All right. Medicare buy-in for 50. All right. Yeah, I've had enough of this. Like what the fuck? I could read this thing. We could conduct an experiment. If I read that article cover to cover, every single word, I wouldn't make it. I'd fall asleep. You would hear a sound, and it would just be a thud, because I would have the article showing, not my face. You would hear a thud, and you'd be like, Ron just passed out on the fucking keyboard. Wait, I'm sorry. You might not hear that thud, because all of you will be asleep too. That's one disadvantage of doing a show like this, where I'm seeing everything for the first time, and it's improv news, and it's just kind of visceral, and we all create it together. Sometimes an article might be full of so much word salad that we just gave all of ourselves indigestion. I have indigestion right now. Some of you might have the shits, because I just shoved word salad down all of our throats. And I'm sorry for that. The person who shared this article was like, hey, this article sucks. Let's do a dissection. So that's what we're doing. And now we all have the shits. Now we all have the verbal diarrhea shits. And it was given to us by this dude. What's the article? The guy that wrote this article. Jordan Weissman. I'm pretty sure we've read other articles from that guy, and I'm pretty sure I've not been a fan of any of them. Oh, and here. Look at how this ends. Here, get ready. All right, sorry. Get your Tums. I got you. Here we go. Look at how this ends. Klobuchar might be aiming a bit low on healthcare. Yeah, you think? As far as some Democrats are concerned. But they should give her credit. At least she's telling them enough to know where she stands. This article could have been 4 sentences. This article could be like, well, federal plan would be easier, but we want to do something way more complicated to keep the insurance companies around. At least Klobuchar is openly admitting she doesn't want to give you health care. That could have been the entire article. That could have been the whole, hey, I acknowledge that Medicare for all is better. I acknowledge that. That should have just been the headline. It should have just been a picture of Amy Klobuchar with her dumb opinions on healthcare, her ridiculous take on it. And then it could have just been like, oh, a federal plan would be better, by the way. By the way, federal. It's just so complicated. Well, unless we do this one thing. It's real complicated unless we do this one thing. You know what? Making soup is really complicated. Unless you just put it in a fucking pot and turn on a stove. Then it's pretty easy. Then it's pretty easy. If you don't do that, though, it's real fucking complicated. Do you see how little sense that makes? Hey, it's really complicated unless you take the obvious solution that makes sense. Making soup would be really fucking complicated. I made soup in a coffee maker once. It was really fucking complicated. It was really hard. It didn't go well. And it tasted shitty because it tasted like coffee. And I didn't think about that part, which was really dumb on my part. But it becomes really complicated. Hey, make soup, but you can't use fire or electricity. You can't use warmth. Try to make it. You got to get a blow dryer for a long fucking time, I'd imagine. That'll probably never work. Or like put it in front of a heater, hope for the best. Man, making soup becomes really complicated. Well, unless you do the obvious way to make soup. Unless you do the obvious, put it in a pot, turn it on, boom, done. Healthcare is really complicated. Well, unless you do that thing that every other industrialized nation in the world has done. Unless you kind of do that, have that obvious nucleus that every other industrialized country has done. If you do that, then it's yeah. If we had a federal plan, that'd be great. But you know what? There's these public buy-in options, and some of them are age restricted. Some of them your state has to decide. Some red states might not decide to. I mean, what's going to be nice? Well, it's based on zip code and blood type, and you get a health credit. It's real complicated unless we do that thing that every other country's done. Unless we just use the roadmap that pretty much every other nation has done. Then it's not complicated anymore, randomly. Jordan should write an article. Jordan Weissman should write an article. Soup is complicated if you have to make it without a stove, by Jordan Weissman. And then he talks about all the... It's really fucking... I don't know. I should write that article. I'm going to figure out a way how to make soup without a stove. I mean, you could just make a cold soup. So there we go. Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. You can tweet me an article at Ron Placone. We'll go through it together and make it our own. Get your